The Conservatives have been running our health and social care system into the ground for years. We know that COVID has made an already bad situation worse, but it was already bad. And my constituents, patients and healthcare professionals can really feel it. I have one constituent who is a professional chauffeur. He needs to provide regular medical assessment certificates to keep his job, but his GP is just not doing them right now. And so my team have had to work hard to ensure that his employer won't sack him. Some of my constituents have managed to see their GPs. One has had a referral for some chronic back pain, another for a diagnosis of breast cancer treatment. But having had those appointments, they then discovered weeks later that the referral letters were never sent. Another constituent has had a contraceptive implant. She's had some very severe side effects. She wants to have it removed. She cannot get an appointment. Another constituent contacted her GP to say that she was having suicidal thoughts. She was asked to fill out a form. I was so concerned about these reports that I have been into our GP surgeries in St Albans. And at the other end of the spectrum, it is incredibly shocking. The very second that the phone lines open in a GP surgery, there are flashing lights on their big screen. Hundreds and hundreds and hundreds of calls suddenly on the electronic board at 1 minute past the time that their phone lines open. Many of those phone calls are from very distressed callers, in pain and very concerned. Many of the people at the counter, the receptionist, people at the end of the phone, are receiving verbal abuse, and we know that GPs are receiving abuse in their surgery rooms behind closed doors as well. And the BMJ suggests that violent incidences in GP surgeries have doubled in the last 5 years. One of the GP surgeries in my constituency has now employed somebody on a full-time basis to do one job: to chase the local hospitals to send the letters so they can get the results that their patients need. We've heard people talk this afternoon, members across the House, about how fantastic it would be if we could use big data, if our constituents could become expert patients and use all the information collected on their phone. But quite frankly, at the moment, we're starting from a basis where we can't even get a letter from a hospital into a GP surgery. It feels as though the entire system is creaking at the seams, and that's even before we get to the postcode lottery of the number of patients that each GP has and the length of appointments. Now, members across this House have talked about the planning system and the fact that there are lots of new homes often built in areas without the infrastructure to come with it, and I wholeheartedly sympathise with those calls. But it seems crazy that under the circumstances, CCGs are not even statutory consultees for planning applications, for local plans, or even for permitted development. It strikes me that it should be a priority of this government to change that and to make sure that CCGs have the right resources to respond to all of those planning proposals. And then we have the system and the problems with dentists. Like many other members of this House, my constituents have raised the same problems. I have mothers with the MATB certificates who cannot get the dental treatment. I have parents whose children are developing gum disease. They cannot get appointments with their dentists. Yeah. Couples who have moved to St Albans who, because they have moved, can't get an appointment with a dentist. The list goes on and on. Yeah. Now, I've challenged the Minister before about the government's announcement earlier this year. The government said it was going to give £50 million to dentists to create some emergency catch-up appointments. Now, when the Secretary of State was challenged earlier this afternoon, he said that that £50 million had resulted in tens of thousands of new appointments. Well, that was news to me, Madam Deputy Speaker, because earlier this year I submitted a number of written parliamentary questions, and I asked the government how many dental practices had achieved the Q3 targets to make them eligible for this £50 million. And the answer was that the government didn't hold the information centrally. I then asked the government how many offers of expression of interest had been received by the deadline of the 3rd of January, and the answer was the government didn't hold the information centrally. I then asked the government how many of those who had offered to carry out this urgent dental practice, how many of those offers had been accepted. And again, the government said it didn't hold that information centrally. So what has happened to that £50 million? How much of it has been drawn down? Certainly, thank you.
No, because she raises some oral questions. The dentists return their data in quarters. We will have that data from the dental community by the end of June, and we will then be able to answer her question. She knows that answer, and she's making a very political point there.
I'm incredibly grateful, Madam Deputy Speaker. I am genuinely incredibly grateful for that answer because I challenged the Minister on this last week and didn't receive that answer. So I'm grateful to receive that response. I had submitted a letter to the Minister, I think it was in April, and attempted to come to some drop-in events that were cancelled. So I'm pleased to hear that that data will be provided by the end of June. But as I say, in my constituency of St Albans, absolutely zero appointments were created from that money on the basis that every dental practice said that it was the way that the funds had been set up. It was simply not possible for them to apply for the funding. And a number of other members have raised that as well. So, Madam Deputy Speaker, the truth is that the government has failed to recruit the GPs that we need. We have a retirement time bomb amongst our general practice, and we know that dentists are leaving NHS work as well. We really need to see a serious plan from the government so that everybody who needs to see a GP or a dentist can actually see one. Thank you, Madam Deputy Speaker.